to talk to you guys about CRMO or CRMO, chronic recurrent multifocal osteomyelitis. This is something that you've heard of before if you're watching this video, otherwise I don't think you would be here. And I thought it was important for me to make a video like this because there's just not a whole lot of information out there. And you might be feeling frustrated with the information or lack thereof that you're getting from multiple specialists about your child's condition. So let's dive in. Let's talk about what CRMO is and let's talk about what CRMO isn't. So CRMO is defined as sterile inflammation of the bone. This is inflammation that starts in the bone marrow. It causes enough inflammation that it actually breaks down bone, and this looks like lesions, usually on an MRI or CT scan. They are looking at lesions that are kind of unexplainable in the sense that there are no bacteria that are causing the breakdown of this bone, and oftentimes those lesions will actually kind of move around the body. CRMO is not cancer. Unfortunately, parents are usually put through the ringer when it comes to getting this diagnosis, and one of the things that they have to rule out is cancer, and that is an extremely traumatic experience for the child and for the parents. What I often find is that parents are given the diagnosis of CRMO kind of when all else fails. So when they kind of go through what ends up being pretty basic testing, even in the world of autoimmunity, even going to see someone like a rheumatologist, I'm often surprised at the holes that are left in proper testing for things like autoimmunity. CRMO is essentially autoimmune because there is some type of attack happening somewhere on the body itself. But it's misunderstood when we call CRMO autoimmune in the sense that it is not your body creating antibodies that are destroying bone tissue. It's autoimmune in the sense that there is an immune reaction, an automatic immune reaction that is occurring, but it's being triggered by something else. And that's really where the misunderstanding comes from. So it's important to test for underlying autoimmune conditions when you're looking at CRMO, but unfortunately, they really kind of miss the mark when they're looking at the gamut of autoimmunity. CRMO is not always explainable by just looking at imaging, and CRMO does not always respond to typical suppressive treatments. You might find that your child was first put on something like hydroxychloroquine. That was probably given to you by your rheumatologist. That's one of their favorite things to prescribe. Maybe then you were given something like methotrexate. Now, methotrexate is supposed to help with inflammation. Unfortunately, methotrexate also depletes folate in the blood. Folate being a nutrient that's usually already missing from a child that has CRMO. When we're looking at immune and autoimmune or overactive immune reactions, we always have to consider that about 80% of the population has undiagnosed MTHFR mutations, which means they are already lacking folate. So to give them something like methotrexate, and then oftentimes the doctor who has prescribed this has suggested something like folic acid, which is not going to replace folate. Folic acid and folate are completely different things. What you might find is that methotrexate has actually made your child's condition worse. So those are kind of first line types of treatments. Then as you move along, and if you're not getting the results that you're looking for in terms of pain management, because that's the biggest symptom of CRMO, mostly for children, then you're going to kind of move into more immunosuppressive type therapies. There is no end in sight for that. Doctors don't suggest, hey, you're only going to be on this for XYZ amount of time, and then we're going to be able to come off of it. This isn't something that children just grow out of. So there's a lot of information and a lot of planning that's missing when it comes to the management of something like this condition. So we kind of know what CRMO is and what it isn't, but where does it come from? So CRMO, just like something like PCOS or IBS. Those things are the names that we give to the symptoms that we're describing, the symptoms that we're seeing. So CRMO's symptoms are, we see bone being broken down on imaging. That breakdown of bone tends to kind of move around. Things will resolve and then they will come back. It's sterile inflammation, so we know that, but where is that inflammation coming from? That is the most important part. That is the piece that we're really missing here. There are a lot of very classic blood work signs that we see in patients who have been diagnosed with chroma. So we'll see high inflammatory markers. Inflammation is not primarily in the bones themselves, it is in the bone marrow. Why would there be inflammation in the bone marrow? Well, a lot of these clues show up early on in blood work. We'll see, for example, high levels of platelets in these children. Now, from what I have seen, parents are usually told, oh, that's just something that we see in patients who have chroma. It's nothing to pay attention to. It's very much something to pay attention to because the body will create more and more baby red blood cells. That's what platelets are. Platelets, a lot of times I think people think of them in terms of clotting factors, and that is, of course, one of the things that they do. But platelets, are red blood cells, are a part of the immune response. Our red blood cells are responsible for acting as antioxidants. So oxidation is a damaging process that happens to our cells as a result of environmental inflammation, internal inflammation, autoinflammation that happens. So those types of things cause damage or oxidation to our cells. Our red blood cells are responsible for acting as antioxidant agents. So they really start to kind of mitigate that damage as well as they can. That is an immune response, and that's why we see an increase in platelet count in these patients who have these symptoms that we call chroma. So the immune system is becoming overactive. It is producing more red blood cells, but it's also producing more white blood cells. It's doing this in reaction to something. The body doesn't just do this for no reason. One of the other types of cells that are produced in the bone marrow are macrophages. So macrophages are cells that are kind of like garbage disposals of the immune system. They're just like going around like little globs, and they're kind of just like eating everything that gets in their way. But macrophages are these big cells, and they actually differentiate into all these different types of cells. Some of the cells that they differentiate into are called osteoclasts. Now, osteoclasts are the type of cells that are responsible for bone breakdown. We have osteoblasts, which build bone, and osteoclasts, which break down bone, and they are supposed to be in balance with one another. Especially in a growing child, they have an abundance of these cells because they are constantly remodeling bone as they grow. Well, when you have this immune response, again, triggered by something, we have an abundance of macrophages, and these macrophages are differentiating into all of their different types of immune cells, one of which are osteoclasts, the bone breakdown cells. That means that bone is going to be broken down at a very rapid rate, but it isn't going to be replenished or replaced by osteoblasts because those are not a part of the same cellular lineage. So that is why we see bone breakdown in chroma. But what has triggered the bone marrow to be producing all of these extra cells? That's why I call chroma a definition of symptoms and not a disease itself. This is the result of something that's going on that's much deeper. So in children, what are our possible triggers? Well, we're always going to be looking at the digestive tract. That is really the place to start. And typically, chromo patients are going to have a pretty extensive history of antibiotic use. They'll also have an extensive history of GI issues, usually from infancy. And we can really kind of track back to what may have triggered the immune system to begin with. But with these patients, we can't just do a stool test, find out what the pathogenic bacteria are, kill the bacteria, and go on our way, because that will kind of trigger a flare of symptoms. We have to be really mindful about stabilizing these patients first. Not just gut related, but we also may be dealing with some actual autoimmune conditions that are not missed or not tested for properly. When we're looking at autoimmune conditions, we aren't just looking at like lupus. I feel like that's a really common one that most people know of. A lot of times doctors will run really basic autoimmune panels, things like an ANA, or a lot of times I see RF factor. Sometimes I think that doctors just run these things because they're like, oh, I heard of this somewhere and it was an autoimmune test, but don't really have any like clinical background for why they would be running these tests. We can run things that are way more specific than something like RF factor, which is usually negative and can even be negative when you have symptoms. So we're going to be looking at things like an ANA, so anti-nuclear antibody panel. Now these are antibodies that are present in a variety, sometimes hundreds of different types of autoimmune conditions. So then we're looking for a titer, and we're looking for a pattern, and we're looking for a reflex. So we want to get all three of those things, and that will help to kind of guide our testing moving forward. So are we looking at more specific types of antibodies? We also don't want to ignore the fact that Hashimoto's thyroid conditions can be autoimmune in nature. That is not something that's going to show up on an ANA panel. But again, a lot of misunderstanding in the traditional Western medical system of how to test for these things. Many times doctors will not run tests that they don't know how to read, which kind of blows my mind, but it happens all of the time. And that's because if they get a positive result, they don't know what to tell you and they don't know what to do about it. There's not really a specialist that deals with autoimmunity. I mean, rheumatology should technically be in that realm. They do a really poor job of diagnosing and managing autoimmune conditions. So when it comes to CRMO, we usually have two root causes, and they're very much linked. We've got something going on in your gut, and then we have a triggered immune system, which generally is coming from a place of autoimmunity, which again is being triggered by that first problem, which is there's some type of dysbiosis happening in your GI tract. If we can get a patient with CRMO stabilized, then we can really start to work on those bottom two root causes. If you can clear up what's going on in the gut, then you can put that autoimmunity into remission and you can remove those symptoms from the child permanently. That doesn't mean that they won't have to deal with autoimmunity in the future, but one of our goals is to identify triggers, manage flares, reduce flares, and also kind of have a long-term management plan for identifying triggers in the future, identifying flares before they start, and having a management plan in place for if you do end up in a flare. And as children get older, because they're not growing and they don't already have an abundance of these bone breakdown cells anyways, you're going to see different types of symptoms when it comes to some type of flare in the future regardless. So if we can kind of get them stabilized, get those symptoms out of the way, get them growing, get their nutrients back. I mean, a body that is in constant survival, that is in fight or flight, that is devoting all of its resources just to living day to day is not going to have the resources it needs for growth in a child. So you'll see a lot, like you'll see a child that seems very pale. Aside from the fact that they're in pain, they won't really have a whole lot of energy. You'll see that they're usually a lot smaller than other children. They're a lot thinner than other children. And all of that comes down to there was something going on in the gut to begin with, so they're probably not absorbing nutrients anyway. Our absorbing is all getting devoted to this constant fight that they're in. So when we can really put those things in perspective and we can get it from a root cause, you're going to see these children just shoot up. They're going to thrive, they're going to be vibrant, they're going to have the nutrients they need, their hair is going to come back. So all of those things that are really scary for parents are 100% reversible, and it doesn't all come back to CRMO. Remember, CRMO are just the symptoms that we see from these underlying root causes. And when we know what the underlying root cause is, we can do something about it. And that doesn't mean being on medication for the rest of their lives. It oftentimes doesn't even mean being on supplements for the rest of their lives either. So if you have a child who has CRMO and you want to know more about this, this has kind of piqued your interest, and most time parents are like, you know what, I knew it. Like a lot of times they can trace these symptoms back to a trigger. A lot of times just intuitively they know, no doctor's ever talked to us about their gut or even suggested stool testing. I always wondered if they have autoimmunity. My mother has Hashimoto's. All of those kinds of things matter. Usually patients will tell you exactly what's wrong with them, especially parents when it comes to their kids, if you just listen. So I am here to listen. I believe you. I know that you know your child better than anybody else, and I know that you want the best for them, and I do too. So if you want some clarity, if you have questions, if you're just curious about the new treatment that has been suggested, I mean, no one wants to put their 5-year-old, nobody wants to put a port in their body so that they can get more IV treatments. I mean, that's wild. This is not cancer. It should not be treated that way. So if you are just thinking this might be a little too aggressive for what I'm looking for, I would love to talk to you and kind of help you to just filter through some of the BS that's in the system. So again, I'm Dr. Arts. Best way to get in touch with me is to go to my website, naturalfertilityandpediatrics.com, but you can also check out my socials on Instagram and Facebook and YouTube. I would absolutely love to talk to you, so I hope to see you soon.